Deciding to conceive is often a big decision, and with recent advances in modern medicine allowing more women to have control over their pregnancies, it has become even more important to know what can affect the success of a desired pregnancy and what you can do to prepare. I'm Dr. Freddy Gomez, and we bring you the knowledge and care you need, especially in this time of COVID-19. You're watching MedTalk Health Talk on CNN Philippines. Following the onset of the pandemic, births in the Philippines have dropped to some of the lowest in decades. As we continue to live with this pandemic, it's vital to be prepared when planning to conceive safely. Let's welcome Dr. Maria Lourdes Cablik, who is an OB gynecologist, fertility specialist, and medical director of In Vitro Fertilization Davao and Brokenshire Hospital. Also with us is Dr. Romeo Lloyd Romero. He's a urologist at Casimiro Inares Senior Memorial Hospital. Dr. Des, what is the most important factor when it comes to conceiving, when it comes to fertility?
Age is the most important single factor affecting fertility. Age at around late teens and early 20s has the highest fertility potential for women. After that, at the age of 30s and beyond, their fertility potential decreases, such that the younger the mom, the healthier the outcome.
Dr. Rome, pagdating naman sa lalaki, meron bang pinaka-important factor pagdating sa fertility?
For males, there are a lot of factors, but the most important is, of course, the quality of the sperm. So in cases that there's a desired pregnancy for the couple, the sperm should be adequate and there's no blockade of sperm. So it's important for the males to have quality and adequate sperm production for him to conceive.
Some factors that can reduce your fertility are things that you can control actually. So Dr. Des, I'd like to ask, aside from age, na talagang hindi ito modifiable, what are some of the other factors that can affect the fertility of a woman?
With ovulation, it is important to note that the regularity of the cycle, then commonly you ovulate, you're fertile most of the time. And with the ovulation, timing of sex, okay? You may ovulate, but you don't have sex, so you won't have pregnancy. And another important factor is the body weight. Okay, so that boils down to lifestyle. So as you keep your weight close to your ideal for your body, then we assume and presume that you have a regular ovulation.
Now, in the country, more and more women are getting pregnant in their 30s. Some may even delay parenthood until age 35 or even older. Dr. Lourdes, mostly this is the case because a lot more women are career-driven. They establish their careers first before that of a family. Is this something that women nowadays should take heed on? What is your advice on this?
The common reason for this is the uncertainty or not having a partner, followed by the wish to establish financial security, and that would mean they have to give way to their career and then before having a kids. No, these women are unaware of the age and relation to fertility. So there goes also that the risk also that goes with pregnancy around this age. If you are at age 25, the risk is 1 in 1,250. But if you are at age 40, complications of pregnancy is as high as 1 in 100 women. And speaking of complications, we're referring to hypertension, miscarriage, birth defects, diabetes. So these are the common and also difficult labor.
Now, it's important to remember that while these risks are likelier after 35, maybe 40 years old, this does not mean that all women are affected. Still, certain genetic risks are more evident as women age. Dr. Des, let's talk about this a little bit more. What are some of the genetic risks naman for infertility?
As your age advances, chromosomal anomaly. That is why there is a higher abortion rate when the woman has an advancing age. And this is particularly due to the chromosomal anomaly that goes with ages.
Dr. Des, when it comes to infertility here in our country, para dun sa mga hindi makaka-afford, they find themselves wanting to have a baby, what are the options for them?
Nowadays, they really make the effort to go to the centers or approach doctors regarding the condition. So the very simple step to help this infertile or subfertile couple is just semen analysis. Okay, so that's very accessible, cheap examination. So with that, you can rule out if the male has a problem.
Is this true? Can someone determine kung sino ang may problema, kumbaga? Or is a viable, distinct test really needed to determine which among the couple needs that?
For you to know that you are infertile, first of all, we tag a couple infertile if they are unable to conceive for 1 year. And we also, for some patients who already have a family, either the mother or the father who already had a child but was unable or having difficulty to conceive after a year, that is called secondary infertility. So you wouldn't know until you get somebody pregnant.
Age could affect a woman's fertility, but men may also be the reason for a couple's inability to start a family. Now, more on this when we return. We're in connection to healthcare. You're watching Let Talk Health Talk.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao, para sa Mindanao. SMC Davao Cement. Ato ni Bay.
Infertility may result from an issue with either partner or a combination of factors that prevent the pregnancy. I'm Dr. Freddy Gomez and you're watching MedTalk Health Talk. We're together in health. The main symptom of infertility is the inability to get pregnant. There might be no other obvious symptoms. Sometimes women may have absent or irregular menstrual periods. In other cases, men with infertility may have some hormonal problems. Infertility can affect one or both partners. Dr. Rome, let's first talk about the causes for male infertility.
The cause of male infertility is basically sometimes a low sperm production or no sperm production, abnormal sperm function, and the blockade of sperm that goes through the urethra through the cervical os of the female. So that is the cause of male infertility.
Ano yung mga common causes ng abnormal sperm production?
One is varicocele, like I mentioned earlier, radiation in some patients who are radiated due to cancer or anything else. And also more common, infections, ejaculatory issues in patients who had previous surgeries. They can have retrograde ejaculation or obstruction, and also some antibodies that attack against sperm, some tumors, chromosomal abnormalities, patients who have hormonal imbalance, taking medications like anabolic steroid use, and in some males who has a bad lifestyle like smoking, drug and alcohol use, and also in some patients who have uncontrolled weight. So those are the things that could cause abnormal sperm production.
Those who use a bicycle to and from to commute work, are they at risk of male infertility? How about those who say that tight undergarments, the issue between boxers or briefs, are these relevant factors when it comes to the health of the sperm of a male?
Yes, that is correct because exposure to high heat could also lead to abnormal spermatogenesis in the testes. So these are also valid factors. No, the temperature in the testes should be optimal for sperm production. So this is very valid. So also one of the risk factors for having infertility, aside from the age, aside from comorbid conditions, extremes of weight.
Is this something that happens often? What do parents of children na nagkaroon ng beke, what should they watch out for?
This could be a viral infection, and the patient will have orchitis. So some studies would also say that there is atrophy of the testis in some cases when there's a history of mumps. So, like what I said earlier, you wouldn't know unless you try or you get somebody pregnant. So, it's a risk factor, like I said, infection. So, mumps or viral infection in the testis.
Napag-usapan naman natin ang female infertility. Dr. Des, yung mga more common causes ng female infertility here in the Philippines.
For women, we have the uterine factors. Okay, so that would mean myoma, especially if the myoma causes bleeding. And then you have this tubal factor. So meaning this tubal we refer to the fallopian tube that connects the uterus to the ovary which is where the egg is coming from. And thirdly is the egg production, ovulation. So these are the three most common.
Family planning is the information, means, and methods that allow couples or individuals to decide if and when they want to have children. Dr. Des, what are some of the benefits ng family planning?
The time frame for this is around 2 to 3 years, especially if the mom delivered normally, that is vaginally, so she can have a pregnancy after 2 years. But if it would be cesarean section, you can delay it longer, so around 3 years, the earliest. And also, having family planning, this would enable the mom to have an ample time to provide undivided care to the baby, to the husband, and to herself.
One of the more common family planning methods is that of the rhythm method, both for the female, they use it as time. How effective is this? And when it comes to contraceptions for males, are there any other options aside from using a condom?
As a urologist, a short answer that we offer is vasectomy. So for vasectomy, family planning is called family planning because a couple should decide, not only the females. So vasectomy gives the males options or can be offered options to start with family planning, with cutting the vas deferens.
Sa isang lalaki, kapag naputol ang kanyang vas deferens, nawawala ba ang pagkalalaki niya? Nawawala ba ang kanyang testosterone sa katawan?
It's not demasculinating. So we only cut the cord that transmits the sperms to the penis. But totally, we are not cutting any circulation of the hormones with which most of the males are concerned of. So they think that there will be shortage of male hormones when you do vasectomy. But it's totally not affected.
Now, Dr. Des, pagdating naman sa female contraceptions, what are the safest options available here in the Philippines?
Modern family planning promotes the use of the hormonal, which is highly accessible, affordable, is the use of oral contraceptive pill. So unlike before, you can just go to the health center, you ask for it, then it is given to you. But recently, you have to buy it. So if you don't want to have this medication taken every day, then you can have the option of going to injectable. So you have your Depo-Provera there. So that is given once in every 3 months, and it is also cheap at cost of 150 per vial, and that will give you a protection for at least a quarter. Then you can have this sterilization, so the female counterpart of vasectomy. So this is highly offered in women who had a cesarean section. And then in the repeated delivery through cesarean section, then you can discuss this with your obstetrician. Then during delivery, then the obstetrician will perform the sterilization.
When we return, we'll talk about the treatment options for infertility and much more. Your health is our mission. This is MedTalk Health Talk.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC. Aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao para sa Mindanao. SMC Davao Cement. Ato ni Bay.
Many people are maybe unaware of their infertility problems. They may cause no symptoms and can go undetected during medical visits, and treating infertility can be complicated. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk, where your care comes first. Infertility is often defined as not conceiving after 12 months of regular intercourse without the use of birth control. How often should the couple be trying?
So the idea is to know when is the ovulation date. Some would say to have intercourse during those times. No? So in some cases, I tell my patient to do it every 2 to 3 days. So it wouldn't be difficult to be doing it every day. So that of getting pregnant. So during those ovulation dates. So nowadays, there are apps that they can download that I tell my patient, especially for the female, they just have to log in the menstruation dates, and it would predict their ovulation date. So nowadays, it's very easy to predict when they are fertile.
Is this a factor when it comes to infertility? Meaning, if someone has a problem such as erectile dysfunction, does this affect the quality of their sperm, or is this totally independent?
It's solely independent, but it is also valid to be asked. So in some patients, you have when the erection is treated, they will be able to conceive.
Dr. Des, I'd like to talk about naman the available options para sa mga couples who are trying to have a baby, who are trying to conceive. 1 year na ang nakalipas without success of having a baby. What are their options now?
If there is a problem for the male, then one can have the intrauterine insemination. So the sperm now will be inserted or injected in woman's uterine cavity around the time of ovulation. Okay, so that is one option. But remember, this can only be repeated around 3 to 6 attempts, provided that the injected sperm has reached around 11 to 14 million. So that is where the quantity of the sperm matters. But if ever the quality of the sperm is low, what we mean by low is that less than 5 million, that's an outright indication for assisted reproductive technology, or what you call in vitro fertilization with intracytoplasmic sperm injection.
When it comes to trying to increase the amount of sperm, Dr. Rome, meron bang mga ways, natural ways, to increase someone's sperm count?
So we have to know the cause of the sperm, why is it low, why it is absent. So in some cases, we may give medications to correct the hormones, or in some cases, just to give you an answer on how to have a healthy sperm. So of course, a healthy lifestyle, like balanced diet, somebody is overweight or obese, to exercise or to lower the weight, to control the cholesterol. Because basically, those things are the ones that alter the hormonal imbalance in a patient. So to improve the sperm count, you have to also live a healthy lifestyle. So avoid smoking, avoid drinking. If you're using drugs, it's also good to avoid it. No, so also the use of anabolic steroids, again, you can avoid those things, no, to improve your sperm count. But basically, it is always problem-based, goal-oriented. So you have to look for the cause of the imbalance.
Dr. Des, can you discuss some other options for having a family, creating a family?
Okay, so the options that we usually recommend today, of course, we have to deal with what will deliver. So with that, we always promote in vitro fertilization after several failed attempts of trying the conventional manner. So if ever a lot of couple cannot afford this intervention, then we would offer quite invasive, and that would be your minimally invasive surgery to overcome the anatomical problem that would help achieve pregnancy.
With that, I'd like to thank obstetrician, gynecologist, fertility specialist Dr. Maria Lourdes Cabling and urologist Dr. Romeo Lloyd Romero. We want to be your partner for a lifetime of good health. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. We'll see you again next time.